So I am charging the United States government with genocide.
In 1972, Dr. Connie Uri discovered that 1 in 4 Indigenous women had been sterilized as a consequence of medical malpractice in the Indian Health Service. With the support of women of all red nations, WARN, Dr. Helen Rodriguez Trias, and Senator James Aberzak, Dr. Uri's investigation led to a study by the General Accounting Office, which supported her findings and instigated debate about the body sovereignty of Native American women. This debate resulted in diplomatic actions, such as the United Nations Conference on Discrimination Against Indigenous Peoples in the Americas in 1977, which discussed the genocidal actions by the United States and proposed remedies to the injustice. In the following years, WARN diplomatically collaborated with other organizations led by women of color to coin the term reproductive justice in 1994. The debate of women's health being a fundamental human right was upheld in the diplomatic passage of the UN Declaration on the Rights of Indigenous People in 2007. Yet these debates continue today as women of color detained by immigration and customs enforcement are coerced into undergoing sterilization procedures, demonstrating how the US government continues to fail in the promise of diplomacy. In 1832, the diplomatic Winnebago U.S. Treaty was negotiated. As a consequence, the United States provided a doctor to the Winnebago people as payment for the land they ceded, thereby beginning a relationship between government-provided healthcare and Native American tribes. In the following decades, the eugenics movement spread around the U.S. as a means to prevent biological and racial mistakes. In the words of Margaret Sanger, founder of Planned Parenthood and a prominent eugenicist, the research of U.S. organizations directly informed the 1933 Law for the Prevention of Hereditary Defective Offspring, which was used by Nazi Germany to forcibly sterilize 500,000 Jewish people during World War II. As a consequence, Raphael Lemkin, a lawyer, coined the word genocide in 1944, meaning the destruction of a nation. At the UN Convention on the Prevention and Punishment of Genocide in December 1948, countries debated eugenics and leveraged diplomacy by declaring genocide an international crime. But the sentiments of eugenics were far from gone, and in 1969, a federal court of appeals ruled in Jessen versus County of Shasta that voluntary sterilization is an acceptable method of family planning. This ruling informed the Family Planning Act of 1970, which made sterilizations more accessible for low-income people on Medicaid. In 1973, the American Indian movement occupied the town of Wounded Knee to bring awareness to violated treaties. Madonna Thunderhawk, a participant at the occupation, reflected that, after Wounded Knee, while persecution of the men was going on, the women had to keep things going. As a consequence, Thunderhawk collaborated with other women across 30 tribes to found Women of All Red Nations, WARN, in 1974, in order to advocate for Indigenous women's body sovereignty. Another supporter of the Wounded Knee occupation was Dr. Constance Pinkerton Uri, a law student and physician with the Indian Health Service, IHS. In 1972, Dr. Uri was approached by Indigenous women who had received sterilizations. In response, Dr. Uri began to investigate the records at Claremont Hospital in Oklahoma, where she worked, and then at other IHS facilities. 2 years later, Dr. Uri publicized her findings. At least 1 in 4 Native American women had been sterilized. After discovering these high rates of sterilization, Dr. Uri collaborated with Dr. Helen Rodriguez Trias, founder of the Committee to End Sterilization Abuse, in order to create a cross-cultural task force to end coerced sterilizations. At this same time, women from other marginalized communities were receiving high rates of sterilizations. With the support of Women of All Red Nations, who helped publicize Dr. Uri's findings, debate about Native American women's body sovereignty was facilitated. WARN co-founders stated that, "We see the fight as having 2 parts, to stop the government's drive for energy resources and to stop IHS hospitals from sterilizing Native women. The 2 together are one fight: stop the genocide of Native American people." Other Indigenous women, such as Marie Sanchez, chief judge on the Lame Deer Reservation in Montana, were inspired to conduct research of their own. After talking with 50 Cheyenne women of childbearing age, Sanchez learned that 26 had been sterilized by IHS doctors. These growing debates led many people to contact Senator James Aberzak, chair of the Senate Indian Affairs Committee, with their concerns. On April 30th, 1975, Senator Aberzak requested that the General Accounting Office, GAO, investigate the Indian Health Service. By 1976, the GAO released their report to the public, which found that between 1973 and 1976, 3,406 Native American women had been sterilized. 13 of these sterilizations had not abided by the 72-hour required waiting period between signing a consent form and having a surgery. A majority of the consent forms used by physicians did not clearly communicate that children or welfare benefits would not be taken away if sterilization was refused. These figures only accounted for 4 of 12 IHS clinics, which caused much debate regarding the accuracy of the statistics. Dr. Uri noted that there are about only 100,000 Native American women of childbearing age left total. In September of 1977, the International Indian Treaty Council, IITC, participated in the United Nations Conference on Discrimination Against Indigenous Populations in the Americas, where the GAO report was discussed and the subject of genocide debated. Marie Sanchez presented on behalf of WARN. The U.S. responded, stating, "The United States categorically rejects the charges of genocide." As a consequence of Indigenous women's diplomatic organizing, in collaboration with other women of color, the Department of Health, Education, and Welfare issued new regulations in 1978. These regulations extended the waiting period to 30 days, changed informed consent procedures, and prohibited federal funds from being used for voluntary hysterectomies. Certain organizations, such as Planned Parenthood, instigated debate, stating that the new regulations restricted women's bodily autonomy. This debate reflected ideological differences between white women, often represented by mainstream feminism, and women of color.
At that point, white women were really focusing on bodily autonomy as in like the right not to have kids. For feminism for women in minority communities was mostly focused on the right to have children. So they differed a lot in that.
Even with the changed regulations, Dr. Helen Rodriguez-Trias recognized that lack of access to abortion services may also push women to get sterilized. Through the diplomatic organizing for body sovereignty by Black and Indigenous women of color, the term reproductive justice was coined in 1994 to mean the human right to maintain personal bodily autonomy. In 2004, Thomas Volsko, an investigative reporter, found that 33.9% of Native American women had received a tubal ligation. Since the General Accounting Office never conducted a follow-up investigation into the Indian Health Service, it has been difficult to determine if HEW's revised sterilization regulations were effective in decreasing the rate of coerced sterilizations. In 2007, the IITC helped co-create with other Indigenous organizations the United Nations Declaration on the Rights of Indigenous Peoples, which outlined guarantees to land sovereignty and the right to have a family free from government intervention. The successful international diplomacy went hand in hand with organizing for reproductive justice. Even so, reproductive justice debates continue today. In December of 2020, over 40 women detained at an immigration and customs enforcement facility in Georgia released testimonies that they had received invasive medical surgeries, many of them sterilizations, without their informed consent. As a consequence of the advocacy of Dr. Constance Uri, Marie Sanchez, and Madonna Thunderhawk, in collaboration with women of all red nations, malpractice in the Indian Health Service was revealed. Their legacy of co-creation with other women of color through the Committee to End Sterilization Abuse lives on today, and Indigenous women continue to confront the consequences of failed diplomacy by advocating for reproductive justice in their own communities. The legacy of sterilization abuse for American Indians is a missing generation of children who may have learned and passed down tribal traditions. Myla Vincenti Carpio.